Welcome back to Healthwise, and we're speaking with Dr. Scott Rohner, Rohner Chiropractic, and we've got some great informative visuals that we're going to get to.
I wanted to get back to that other one we just had up. Like I said, on the left is the incorrect lift. You can see that the person has their legs straight. So the only way for them to actually be able to get down and reach that wash tub up, pick that wash tub up, is to bend over at the waist with their arms dropped down. And what that does is it puts the heavy weight far away from the center of balance of the body. Where if you look at the other side with the correct lifting, he's got the weight closer to his body, and he's going to have to lift the weight, but he's not going to have a torque angle or torque opposed on his low back. So it's the same amount of weight, but the amount of pressure on the low back is tremendously different. So if we look at the next picture, we can see people in their different postures. These are some little cartoons that look like primitive drawings, but what they actually did to get the numbers that are underneath those, that's the interdiscal pressure. So they actually put needle sensors, pressure sensors, inside the discs of the volunteers, and they had them sit. So if we look at the person up on the top right with their foot underneath their low pressure, underneath the stool, or on top of a stool, he's got 100 pounds of pressure in his low back. And then the next one to the left where he's slouching, he's got 150 pounds of pressure. And then the one all the way over to the left, top left, he's got 200 pounds of pressure. He's got twice as much pressure in the disc. The discs don't like the pressure on it, and it's really going to cause them to start to deteriorate a lot faster. So if we look at the person standing, the one to the right, he only has 100 pounds again. So that's our upright position, whether we're sitting or standing in that uprights with our body without that torque angle I talked about. And as soon as he bends forward, there we are washing dishes or brushing your teeth. There it is, 200 pounds again. So that's why we want to see people be able to stand in that erect posture. And then the lying down, you see your pressure is cut in half. So there is some intradiscal pressure that's always going to be there. But the one below it cuts it down to 25 pounds. That would be somebody that has disc problems. You can come back to us. And that's going to be somebody that has disc problems. That's going to be their first aid posture for them to be in. So they should lie on their back with a pillow underneath the knees and the feet slightly elevated. So if you have an acute episode of back pain, or if you deal with daily chronic back pain, then you should assume that position when you're going to rest. So your chronic pain patients, they should try to find a position like that throughout the day to take the pressure off the discs in the low back. And then the acute ones, if you might have to help somebody actually to get to a comfortable spot, and that would be a first aid position for them to be in. Okay,
and we're moving on to our visuals.
Okay, so we got this. Now we're going to look at the posture of a person. This one on the left is their perfect alignment, straight up and down. Mm-hmm. And then the one on the side, we see the curvature of the spine. So really, the one I want to show you more is the one that's on the left side. You see how the spine's straight up and down. We'll go on to the next one, and now they've got a curvature. So people would see an X-ray, and they would say, "Oh my gosh, my back's out of alignment. I need to get an adjustment for it." And a lot of people have a notion that we can just simply take that vertebra and push it back in to the position it's supposed to be in. But if we look at the next picture here, we see that there's actually a set of muscles that are associated with this. So the lighter colored muscles are weak muscles, and the darker ones are the tighter muscles, and we can or the weaker muscles. So we'll see that those tight muscles will pull the spine into a certain direction. So the posture of the spine, the misalignments, at first are related to muscular problems, and you can come back to us again. So we have what's called axial back pain that's or neck pain. It's axial spine pain. That's when we have a person that has neck pain and they have low back pain. Then there's a peripheralization of the pain. So then they have the pain that can radiate out, and that pain can come from different sources. The way to differentiate what a different type of pain that people has is the character or the quality of the pain. So if a person has a sharp pain, it's going to be coming from cartilage. it's coming from the joints. So if you
Okay.
feel that sharpness, then that's where that's coming from. And we know that because that's the joint receptors that are there. They feel that type of pain in them. If you have more of a dull ache, that's going to be more muscular pain. The nerve pain is going to be something that is, it may start axial, but it's going to go into the arms and legs, and that's going to be electric shock sensations or numbness and tingling. So the visuals that I brought for today primarily are going to be associated with the muscular referral of pain. So yes, we have back pain, but we also have these other types, shoulder problems, hips and legs. So let's go ahead and go to the next visual there.
Okay.
And here we see what's known as a trigger point. So they have an X. The X is where the trigger is, and then the red area is where the pain distribution pattern is.
Okay.
So if somebody has buttock pain, or they have pain over their sacroiliac, like the one on the left, or in their buttock like it is on the right, what we're going to do is we may do some therapy to those areas. They may come in and they may get some electric muscle stem. They may come in and get some ultrasound to those areas. They might even go to get massage on the area that hurts. But until we really locate where that pain's coming from, and we put our finger on that X, and I can see where a person on their pain diagram when they come in, and I see where their pain is, and then I apply the pressure to where that X is, and they say, "My gosh, that's it. You hit the spot." We know that that's where it's coming from, and when we treat that area, that's when we get lasting relief. So let's go ahead and go on to the next one. And then this we see all the time, people with hip problems. And when you saw you can come back to us for a second here. When we saw the person that had the swayed back and their back wasn't in good alignment, some of the muscles that we saw in that picture not only are the ones along the spine, but they're also the muscles in the hips. So those muscles, we're going to see a weakness in, specifically the gluteus medius muscle. So that muscle, whenever it is weak, it produces pain. You may have some hip pain with that, but you're also going to have a lot of pain radiating down the leg. Now, in that person, in that particular set of circumstances, spinal manipulation isn't necessarily going to be the best treatment for it. We need to do some treatment specifically to that muscle. They may actually consult a surgeon that says that's a real case of sciatica, and they may actually have surgery for it. And those would be what we'd see would be your failed surgical cases, where it wasn't coming from a disc that needed to be excised. It was actually coming from a muscular trigger point. So if we go ahead and go back to those again,
okay.
We'll go ahead and go to the next one. This is another set. This person has a trigger point in the gluteus minimus muscle, which is another one in the hip, and they're going to have a lot of pain referral into the buttocks and into the back of the thigh, and some pain down into the calf. So again, those are related to those trigger points in those muscles. So let's go ahead and come back again. Another differentiation of leg pain, a lot of people talk about sciatica. Sciatica is pain that comes from the sciatic nerve. The sciatic nerve is derived from some nerve branches that come out from the lumbosacral spine, the lower part of the spine. They pass down through the buttock muscles. They pass down the back of the thigh. They emerge as sensory muscles below the knee. So whenever somebody has nerve pain, they're going to feel it where the end of the nerve is. So if somebody has sciatica, true sciatica, they're going to have pain below the knee. So as a general rule, if you want to see if somebody might do better with chiropractic care or with physical therapy, or whether or not they need to have surgery, the surgical cases would be the ones below the knee, more likely that's going to help them. If it's a pain in the back of the thigh, or what we call axial back pain, the surgical cases or surgeries aren't going to be so good for them. They're probably better suited seeing their chiropractor and going through the therapies for that.
That's pretty interesting, because we often hear about people saying they're suffering with sciatic nerve problems. So that's some good points that you brought out, Dr. Rohner. But we've got to take a break right now, but we will be back. You're watching Healthwise, and we've got to take a word from our sponsor.